Good afternoon, everyone. This is Olivia Marquez from the NCCMT, and I'm a research coordinator for the Spotlight webinar series brought to you by the National Collaborating Center for Methods and Tools. Thank you to those who have joined us this afternoon for the Spotlight webinar series, and today we will be featuring EENet, Mental Health and Addictions Knowledge Translation Resources. So we'll quickly review just a few housekeeping items before we get started. So please see the chat section on the bottom right-hand side of your screen in WebEx. Please post any questions or comments that you might have during the webinar here. We'll have a designated open Q&A session at the end of the presentation, but please feel free to post any questions or comments that you have during the webinar, and we'll answer those as we move along. Please post your comments in the chat section and share your comments to all participants. This way, other participants may have the same questions as you. Today, we recommend using a wired internet connection as opposed to wireless. And if you have any connection issues today, you can use the WebEx 24/7 helpline, which is posted on the slide and as well in the chat section. We have a support staff here, Rowan, who is available to assist with any technical issues that you might have. So feel free to send a message to Rowan in the chat section if you have any issues. After today, the PowerPoint presentation will be made available in English and French. The English audio recording will also be made available on the NCCMT's website. So these resources can be accessed using a link posted in the chat section. And we will have these posted within a week or two of the presentation. We have our first polling question today, and we'd like to just get a sense of the audience that's joining us. So we're wondering how many people are listening to today's session with you. So you can indicate if it's just yourself, if you have 1 or 3, 4 or 5, or larger groups with you. So you can answer this poll question in the right-hand panel of WebEx, and just a reminder to hit submit when you're finished with your response. So thank you to those who have responded. We see most of you are joining just yourself, and we have one person who's joining in with some colleagues with them, so that's really great to see. Thank you to those who are responding. So I'd like to officially welcome everyone to the NCCMT Spotlight on Methods and Tools webinar series. This is our 36th episode of the webinar series, and we're featuring EENet, so the series of mental health and addictions knowledge translations resources. So we have the links to the NCCMT registry summary page, and that will be posted in the chat section. And today we're going to have Nandini, who is going to go through the resources themselves, and then we'll have 3 different user stories, which are really going to highlight the scope of these resources to you. So for those of you who may be unfamiliar with the National Collaborating Center for Methods and Tools, we're one of 6 national collaborating centers across Canada, funded by the Public Health Agency of Canada. Here at the NCCMT, we're located at McMaster University in Hamilton, Ontario. While the other NCCs focus on the use of research evidence in specific public health content areas, we here are focused on improving the access to and use of methods and tools for health professionals in practice within Canada. We're not content specific, but we offer methods and tools that can be applied across different areas of public health. The NCCMT has many products and services available through our website. These are just a few of the products and services that we offer. So many of you may be familiar with some of these. Today we will be highlighting a tool that is located in our registry of methods and tools. So you can see that at the top. And note that the NCCMT also offers a variety of online learning opportunities through online modules. We offer links to Public Health Plus and a variety of other multimedia tools for you to use. So we have our second polling question today, and we're just wondering how many of you are familiar with the method or tool that we'll be reviewing today. So either you're not familiar, you've heard of EENet, or you may have actually used their resources before. So again, we just ask you to answer in WebEx and make sure you hit submit at the bottom when you're finished. So thank you to those who have responded. We see a few people. We actually have an almost even split between people who are not familiar, people who have heard of the method or tool, or people who have actually used it. So this is really great to see, and we're sure that no matter what group you fall into, you'll be learning something new today. So without further ado, we'd like to formally introduce our presenters today. So it's my pleasure to first introduce Nandini Saxena. She is the Manager of Knowledge Translation, of Knowledge Exchange in the Provincial System Support Program at the Center for Addiction and Mental Health, so CAMH. And Nandini has worked in the fields of international development, citizen engagement, and the development of public policy. She's worked in knowledge exchange for 20 years. So we're really pleased to have her review the EENet resources themselves. And I'll also just introduce the three of our user story presenters. So we have three people who are going to discuss their use of the EENet resources. So we have Betty Lou Christie, who is the Peer Support Substance Use Systems Lead for Enhancing and Sustaining Peer Support Initiative. So Betty Lou has spent the last decade as a provincial system level lived experience family advisor, educator, and advocate, helping to frame policy, governance, and programming. She has a very impressive background in addictions and mental health, and her professional background in corporate marketing. She's won a number of awards in the field as well. We have Jessica Patterson, who is a health promotion specialist with the Mental Health Promotion Program at Toronto Public Health. And in her over 6 years in this role, Jessica has worked to support the integration of mental health promotion into public health practice at the individual, organizational, community, and systems level. And lastly, we'll have Rod Olfert, who is a Senior Integration Specialist with the Champlain Local Health Integration Network. And he manages the addictions and youth addictions and mental health files in the region and the orthopedics file. So Rod brings over 30 years of experience in the field of addictions in the areas of knowledge exchange, training and education, and clinical practice. So we're really excited to have our array of presenters today. Without further ado, I'll pass it on to Nandini.
Thanks so much, Olivia. Really appreciate the introductions. So I'm going to, sort of as a bit of context setting and background, I'm going to provide a bit of overview of the Evidence Exchange Network, or EENet for short, and give you a bit of overview as well of the different kinds of knowledge exchange resources and tools that we offer different stakeholders of the mental health and addiction system. And then really grateful that we have three users of our resources and services who will be speaking to their specific experiences of working with EENet and the different kinds of resources that we provide. So a bit of background about EENet. So as the slide indicates, we are a province-wide knowledge exchange network. And really, I would say that the primary function of the network is to connect different stakeholders of the mental health and addiction system, both with each other, as well as with different forms of relevant, actionable evidence. We work with different kinds of stakeholders, including researchers, clinicians, service providers, system planners, policymakers, people with lived experience, and family members. We also work across different sectors, including not only the mental health and addiction sector, but also very much so with public health, justice, and primary care. And in terms of the sort of the content areas that we focus on within mental health and addictions, it's really all the way from mental health promotion, prevention, early intervention, treatment, all the way through to recovery. So we really sort of, in terms of the different kinds of knowledge exchange supports and services that we provide, it really covers sort of the full range. So these are some photos of some of our team members. And we have a team of knowledge brokers and communication specialists located across Ontario. So here you'll see three of our knowledge brokers, Alex from Barrie, Matt from Toronto and Angela from Toronto as well. And we are situated organizationally as a part of the Provincial System Support Program at the Centre for Addiction and Mental Health. So just to give you a brief overview of the work of the Provincial System Support Program, we do work collaboratively with partners from across different sectors, and really our mandate is really to support the translation of evidence into programs, policy, and practice. As a part of our mandate, we support Ontario's 10-year comprehensive mental health and addiction strategy. So in terms of how we do our work, we have different teams of people within the program who have different kinds of expertise, including, for example, knowledge exchange, which is really the evidence exchange network team, implementation science, health equity and engagement, coaching, evaluation, and information management. So some of you might be aware of some of the work that we've done to support the rollout and implementation of, for example, the stage screening assessment set of tools. And that's really a set of tools that different service providers can use to ensure that people are directed to the appropriate level of service within the mental health and addiction system. And they really support with appropriate treatment planning as well. So we have offices across the province. So you'll see on the slide in front of you that we have regional offices located all the way in Northwest Ontario, in Kenora, all the way over to Kingston, from London up to Ottawa. So we have a really good sort of on-the-ground provincial presence, which I think really helps us in our ability to do our work. And then we have a provincial office in Toronto. So a bit about EENet's mandate and vision. So really, in terms of our mandate, we really sort of work with different kinds of stakeholders to build capacity to co-create and use evidence. And really, our overall goal is to really improve how the system works. So really, it's about using evidence or supporting stakeholders to use evidence to improve policy programs and practice. And really, we're working towards a more collaborative and evidence-informed mental health and substance use system that meets the needs of all Ontarians. You'll hear from some of our panelists shortly about some of the different EENet initiatives that we undertake to work towards our mandate and vision, which really includes some of the work that we do around communities of interest, communities of practice, developing evidence overviews through different kinds of literature reviews and rapid reviews, and also our work to make available and accessible different forms of evidence that will be useful to different decision makers in the system, including the voice of people with lived experience and family members. So I'll give you a bit of background about how we define evidence, and I also notice, I think this might be of interest to people on the webinar, that the way that we define evidence is also very similar to the National Collaborating Centre for Methods and Tools Evidence-Informed Public Health Framework, because I know the NCCMT makes reference to different forms of evidence which really together make up evidence-informed decision-making for public health. So I would say we use a very similar model to the NCCMT. And so really, as the slide shows, we really look to make available different forms of evidence, including obviously research, really the practice-based evidence of people who've been working in the system for a long time, so really the professional expertise, the lived experience of people and families, and I think you'll hear quite a bit about that from Betty Lou Christie, who is the co-chair of the EENet Persons with Lived Experience and Family Member Advisory Panel, as well as cultural and traditional knowledge. So this slide provides a bit of an overview of the different kinds of knowledge exchange support that we provide. So one is, as I mentioned before, we have regional offices located throughout the province, and those teams of people, we call them regional implementation teams, they work with local organizations and service providers really to support through a multidisciplinary process to support the implementation of evidence-informed innovations and interventions into practice. So one specific example of this was we have supported something called the Systems Improvement Through Service Collaborative, which was an initiative of the provincial government which aimed to help communities address service gaps in mental health and substance use services. So for this initiative, EENet knowledge brokers worked as a part of these larger teams in these different regional offices. And the work included a variety of different kinds of supports, including, for example, developing knowledge exchange plans, gathering and synthesizing evidence to support communities in their decision-making process about which evidence-informed intervention would be most appropriate to implement to address the specific service gap that was identified. And then also very much really sharing out, some of the ongoing lessons learned and results from these different implementation initiatives through the development of different kinds of knowledge resources, for example, plain language summaries, videos, so that we could really share our implementation learnings with other organizations and communities who could potentially be interested in implementing similar types of interventions. Another example, which is very specific to the public health system, is the support that EENet has provided to the development of 2 new guidelines for the Ontario Public Health Standards. And these 2 guidelines focus specifically on substance use prevention and harm reduction, as well as mental health promotion. So again, the types of supports that we included as a part of this overall process to support the Ministry of Health and Long-Term Care was around evidence synthesis, providing subject matter expertise related to mental health promotion and substance use prevention and harm reduction, and working with different provincial stakeholders to really reflect sort of an implementation lens as well in the guidelines that we supported the development of. And another example I'll share is some of the work that we've done to support the Ontario Mental Health and Addictions Leadership Advisory Council. So this advisory council, it's an advisory body that was really formed, I think, about 3 years ago now, to support and to provide recommendations to Ontario's Minister of Health on the implementation of the overall 10-year comprehensive mental health and addiction strategy. So we provided that council with different kinds of support, including, for example, facilitating access to evidence that they needed through development of a variety of different kinds of evidence briefs. And you'll see if you go to the Ontario Mental Health and Addictions Leadership Advisory Council, the specific evidence briefs that we developed. We also developed and have been maintaining and promoting the council's website, which is really sort of a website that the council really wanted support to really promote, so that the work of the council is really shared broadly with different stakeholders of the mental health and addiction system across the province. And we've been promoting the council's annual recommendations and various annual reports as well through social media to really disseminate their recommendations to people across the province. So in terms of the different kinds of knowledge resources that we develop, up here on the slide, you'll see a bit of a sample of the different kinds of resources that we develop. And as Rod Alford, one of our panelists today with the Champlain Local Health Integration Network will describe shortly, through our rapid review service, we really respond to specific requests for evidence from different kinds of stakeholders. So really to help them ensure that their decisions about services and programs and policies are really informed by available evidence. So as you might be aware, these rapid reviews are highly focused in scope, and we really tailor them to meet the stakeholders' specific decision-making needs, so that it's really as useful as possible. And this is really, as I mentioned right at the start, this is really about this is one mechanism that we use to make relevant, actionable evidence available to different stakeholders in the system so that they can use this evidence to inform different kinds of decisions. Another example of the knowledge of different kinds of resources that we develop We also develop, a wide range of different kinds of plain language summaries, including infographics, profiling promising practices, where there isn't necessarily really strong evaluative evidence, but the anecdotal evidence would suggest that it's something worthwhile sharing with different stakeholders in the system. And also just sort of brief plain language snapshots of different research studies and research reports. We've also been experimenting more and more with the development of different kinds of videos as an engaging way to share different kinds of evidence. So, for example, we supported a series of projects that were really designed to improve how the substance use treatment system works in Ontario. So we developed a number of videos to support that specific initiative. And finally, very similar to the NCCMT, we do a series of webinars where we can profile different kinds of provincial initiatives and projects to share their knowledge with stakeholders across Ontario in real time. And again, similar to the NCCMT, we really design our webinars to be interactive through the use of, for example, polls, panels, and Q&A sessions. So in terms of bringing people together, two main functions that we have under this area of work include both communities of interest and communities of practice. And since 2012, EENet has been providing knowledge exchange support to a variety of different communities of interest. So through these COIs, we bring together diverse stakeholders, including service providers, researchers, system planners, who are interested in a common problem so they can really develop, co-create, and share new knowledge that will help improve understanding around that specific problem. So the COIs are really that are a part of EENet take a provincial approach, focused obviously on mental health and addictions, especially as it relates to systems and services. So some of the topics that are covered by our current group of EENet COIs include COIs that focus on family caregivers, housing first, which is a model to support people with mental illness and addictions, focused on providing housing first plus other types of psychosocial supports. We have another COI that looks specifically at the needs and challenges that racialized populations experience within a context of mental health and addictions. And we also support a COI that is focused specifically on alcohol policy in Ontario. More recently, we've started to provide support to a number of different communities of practice, which bring together, similar practitioners to focus on a specific issue. So we have one COP that is focused on mental health promotion in public health, and Jessica is going to speak to that specific initiative in a few minutes. And we also have another COP that is looking at opioid overdose prevention and naloxone access, which brings together different public health and other stakeholders around this very important issue. Another mechanism that we employ to help people connect with each other and share information and evidence is EENet Connect, which is an online community. And currently, we launched it in 2013, and we now have over 8,200 members. And it really provides a venue and a place for people to ask questions, share information, and connect with each other. Since it was launched in 2013, the community has really grown significantly in terms of just numbers of people who are connecting with each other online. And it's a very active membership, and we have many different both public and private forums and a well-used crowdsourced events calendar. So some of the active public forums on EENet Connect that you might be interested in looking at include the Alcohol Policy Forum, Transition Age Youth Forum, as well as a public forum that looks specifically at treatment issues related to substance use and mental health. So we've done all this work, and always the key question is, how are we doing? So we have done a number of different evaluations over the years. And so a recent evaluation that was conducted in 2017 by an external evaluation company found EENet to be a central body or organism that connects stakeholders in the mental health and addiction system. And I think that's actually a very, it's a significant finding for EENet, because one of the challenges, and I think this has been noted in different policy documents related to the mental health and addiction system, is that there continues to be a lot of siloing within the mental health and addiction system, both between stakeholders, between mental health programs and services, and addiction services. So this function that EENet is able to provide through connecting people with each other is actually a really important function that we can help support the system with. Another finding that we had through a social network analysis that Dr. Karen Urbanowski, who's now with the University of Victoria and also cross-appointed with the Center for Addiction and Mental Health, through this social network analysis conducted in 2014, EENet was identified as the 7th most useful source of evidence about mental health and substance use, and the 8th most used source of evidence within the larger system of sources of evidence. So again, I think these are all sort of really helpful findings for us. And so I think it sort of gives us information in terms of where we can be most useful to different stakeholders in the system. So I think that's the end of my section, Olivia.
That's great. So thank you, Nandini, for reviewing the scope of EENet. I'll pass it along to Betty Lou.
Great. Okay, I'm just putting my first slide up there, and there's a little, just a slight name change there from the organization, but I'll explain that later on and how EENet has helped us through that process. Definitely that picture of metamorphosis is something that's happened for myself personally, and EENet has played a huge role in facilitating that for me. Let's go on to the next slide here. So I'm going to come from I have the absolute pleasure of coming from this from varied perspectives of how the Evidence Exchange Network actually elevates the use of lived in or family experience as a form of evidence in Ontario's mental health and addiction system. So I'll first start as a citizen, as a personal systems advocate, then I'll go into being the co-chair of the Lived Experience and Family Members Advisory Panel, and of course, as next year, as a systems lead for the newly renamed Center for Innovation and Peer Support, and how that support actually helped to achieve the goals. So from the perspective of a citizen, a personal systems advocate, and what that support looks like, previous to this, which is part of the metamorphosis, my background was in corporate marketing. Part of that you probably caught in the bio part, I have lived experience and family experience in mental health, addiction, trauma. But I also lost my 25-year-old son, Pete, to an accidental opioid overdose, and that was 16 years ago. And there was a lot of systemic gaps, and I definitely would consider that he would be one of the first rounders of the amount of overdoses that are just escalating. And just because of the system gaps that were happening, I ended up that I wanted to be part of the solution, and just kind of morphed into this being that was doing a lot of peer support and outreach at community, and then just realized that there was a disconnect because money was going certain ways or programs weren't what they needed to be, and realized that where the voice of lived experience and family members needed to be was at systems level. And nowadays you'll think, well, that's not unique, but back then, when I started this journey about 10 years ago, that was not unique. That was very unique, and EENet helped to facilitate that quite a bit just in their approach, because one of the biggest things is that trying to capture the complexity and the impact of systemic gaps that significantly impact the ability of people to find their wellness, it's a really delicate balance when you're trying to lead a change process that involves the transfer of personal lived expertise to provide evidence towards system transformation and person-directed care. And there's a lot of bumps and bruises along the way. I mean, there's a much more uptake now, and there's some places that do it very well. There's other places just starting, and there's other places where it's not there yet. But for my personal, as being just a citizen, a volunteer, EENet right from the very beginning and just really embraced and tried to facilitate what I was doing. And some of the things that were really good was they hosted me to do a 6-part blog series. And that was back in 2013-14, and we called it Bringing It Home. And so I would write it, and then Jason Thurell, who's there, he would be my editor to help just kind of bring the pieces together. And it kind of, the 6-part series kind of went over a year, and I pretty well had free reign about what I wanted to speak to. And it was a fantastic process because I was empowered, but it also didn't stifle my creativity or my, my messaging, and the fact that I'm trying to humanize a process and humanize a system to actually find the relevance. But it was great because I could be my old quirky self, and I mean some of my blog series was about Winnie the Pooh and how that Winnie the Pooh compares to meaningful engagement of lived experience and family. Another one was Let's Talk Big Bad Wolves. It was an incident I had at systems level where people who should have known better were really brutal to me because I was delivering a message of lived experience in my very, I think, eloquent and polite way, and I got really bashed, and it caused me a severe trauma reaction. So, I had the creativity to write about that and have EENet host that. Another one was A Tale of Two Rabbits, and it was drawing the parallels to Alice in Wonderland, about Alice in Wonderland and what that's like trying to negotiate the mental health and addiction system. So it was a wonderful process, and that really helped me to get my voice out there as expertise, to be seriously considered as a piece of evidence, and to actually, help me and facilitate my own healing from everything I've been through and losing my son. The other one that Nandini mentioned, which I loved, has been EENet Connect, the online community. I think I'm in second place behind one of the EENet staff. And I don't do social media because I'm an advocate. I don't do any type of social media. But on this one, because there's such a professional, polished platform, but once again, allowing people to be creative and express, and it's a very unique experience, and I found that I post a lot there, I spend a lot of time reading there, I've made a lot of relationships there, a lot of networking and connections, but as well as that too is that like researching things, like I can find it's so much information there of everything that I need, and then if you need something else, you just kind of put a shout out to the rest there. So that was a great facilitator in my metamorphosis. Let me go to the next one here. Oops, hold on here. So the next one is the EENet People with Lived Experience and Family Member Advisory and what that looks like. So I have the absolute honor of co-chairing that, and that originally started right back in 2012, and that started out with the Health Canada Drug Treatment Funding Programs, DTFP, advisory, and it evolved from there into a really well-respected EENet Persons with Lived Experience and Family Member Advisory to many, many provincial systems-level projects and initiatives. And there's a real expertise to that, like trying to nurture a group and facilitate a group. And I think that my quote up there is on the slide. It's so uniquely important because we have to get past the part of like just kind of picking people off the street and going, oh, you have lived experience, come sit at this table, because you really have to nurture to get meaningful engagement, and that is something that the Evidence Exchange Network just did naturally right from the beginning. I spent a lot of my time helping other people to create advisories and do things, but right from the very beginning, I didn't have to do that with the Evidence Exchange Network. They provided leadership. They reduced barriers, as in travel accommodations, honorariums, teleconference. They properly vetted the incoming consultations to ensure like it's a genuine engagement, timing, prep needs are addressed, providing avenues for loopback. Things like, you know, did you use the advice that this advisory gave you, and if not, why not? I mean, it's cool if you don't, but we need to know that we're not just advising to all these projects, and if it's not, we need to know what happens with all the effort that we put into that. Sincerely nurtured meaningful engagement, and EENet truly respects and values the team, and that is so, so important. Some of the examples of the provincial consultations is great. Like I said, Dr. Brian Rush and Ontario Perception of Care for the OPAC development. They keep coming back and back and back as everything processes there. The Ministry of Health and Long-Term Care for the communication strategy for the opioid policy. Dr. Karen Nubanowski for the drug treatment funding program, strengthening performance measurements for mental health and addiction. And that was a really unique one, because off of that one from the discussion, she did a side paper that I was allowed to co-author on that was about the data needs and strengthening performance measurements specific to peer support. So that was a really lovely experience, and that research really, really helped me in my job. The Health Quality Ontario Opioid Use Disorder Quality Standards, the Health Minister's Leadership Council, the Core Services Development, and of course the EENet Sharing Together Evidence Priority. So, and that's just a few of them, and we haven't even actually advertised the group per se yet. It's just got through from word of mouth. And so yeah, there's some, it's really nice to have a unique one that comes through. So the next one is that from all these processes, there was a big initiative here, which you can see, and I was hired for it, and as a systems lead, which is now for the Center for Innovation and Peer Support. And what the support looks like from EENet, because it's a large initiative in that it's widespread through the Mississauga, Halton, Lynn, but we have 40 paid full-time peer support positions embedded across 11 accredited Lynn-funded healthcare organizations, including hospitals, community providers, such as hospital psychiatric inpatient units, addiction residential treatment, supportive housing, central access, employment, support programs, community mental health and addiction providers, self-help education and support groups. We also have additional agencies that we support. So across this program, there's 40 peer supports, over 25 different programs, and 24 peer supervisors. So there's myself and Christina, who are the system leads for this initiative, where they actually are looking at sustainability. And we're a very small team for the scope of this initiative. And if it wasn't for the help of EENet, because the fact is that we have identified through all of the process and excellence through quality improvement, the root cause of role clarity in peer support and just the fidelity to peer support and what that looks like when you're embedded across that many different agencies. So we ended up that we have to develop a validated tool to actually get baselines. There was none provincially, so we came to EENet and said, hello, can you help us with this? So they actually did a literature review on the specifics of what we were actually hoping to find information. It was kind of a bonus that it hadn't actually been done before, so it really validated the fact that we have to go through the processes of and methodology and rigor of creating a validated tool and the ethics, the reliability testing. And so that's been a huge piece, because without that literature review, we didn't have the capacity here to be able to do that. And the second piece that they're doing for us now is that we have won several awards, and we're working right now on featuring a promising practice for the Center for Innovation and Peer Support. And once again, it's because it has unique system change, and one of our spheres of influence and impact, as you can see from there, is provincial systems level and actually system transformation. It's just going through those processes to do it properly. So by EENet featuring us on a promising practice, that's going to hold the space for us, and that's going to help us to get the word out even more, because we're so connected provincially and on the ground. So we kind of have myself, who's provincial and really has, well, the mental health and the substance use lens, and then Christina, who's like really regional and on the ground. She works with all the networks and all the peers and auditing agencies. So it's quite the project, and we couldn't have done it without EENet, which brings us to the next one that we're going to probably ask about after our promising practice, which is implementation science. And that's something else we can see as another tool that EENet could help us with. So basically, in closing, I think that, you know, when you say how that supports help to achieve goals, when you're thinking of patients first, and you're thinking of it, it's not even just solely to mental health and or addiction system. You're looking at primary care. You're looking at any type of place where people in recovery and trying to actually, you know, from all ages and all stages, and the fluctuations in recovery when you have chronic and or acute bouts along your journey to wellness, and trying to find that place where we can support people across the spectrum. There's peer support, and that can fit in any type of demographic, including family to family. And you know, the thing that we have found is that, as the quote says here that I wrote in a report, is that when allowed full and equitable political and social power with meaningful involvement in the governance, policy development, planning, delivery, and evaluation, people with lived experience, family members, and peers can provide unique and relevant context upon which to work with and base decisions on. And the very last one here is the tail end of that one, which is the lived experience of people, families, and peer support is shaping the cultural shift from storytelling to evidence, providing evidence and empowering each other to inform across the evidence change. And it really is. It provides a roadmap to affirmative change. So our personal journeys equal living expertise, which equals experiential evidence. So thank you very much.
Thank you very much, Betty Lou. We're going to pass it along to Jessica.
Great, thank you. Let's see here. Great, so thanks so much for having me today. I just wanted to say a little bit about my role here at Toronto Public Health. I'm a health promotion specialist, and I've been on the mental health promotion team here at Toronto Public Health for just about 6.5 years. I work on a team of 9 mental health nurse consultants and myself, and our work is to support the integration of mental health promotion into services that are delivered by Toronto Public Health, and also to support the uptake of mental health promotion strategies in the communities that we serve. So that might be newcomer agencies, shelters, employment and social services agencies, things like that. And we work across the lifespan, so we work on topics such as mental health literacy, workplace mental health, suicide prevention, gender-based violence, for example. And I'm one of the 2 co-chairs for the Mental Health Promotion in Public Health Community of Practice. And I just want to say hello, or maybe a shout out to my co-chair, Ben Lakin, who's a supervisor of mental health at Ottawa Public Health. So just to set the stage for my work with EENet, I thought I would give you a bit of background about our community of practice and where the need for this came from. So historically, mental health promotion had not been very well defined in the Ontario Public Health Standards, but many public health units across the province, including Toronto Public Health, have a long history of doing this work. And sometimes this work, the mental health promotion work, has not been explicitly labeled, and often it had been more seen as a byproduct of programs. but we knew people were working in this field and it just wasn't well defined in the standards. So in order to address some of the confusion and sort of the role clarity around this work, in 2013, Public Health Ontario and CAMH, the Provincial System Support Program, and Toronto Public Health partnered to conduct a survey of all 36 public health units in Ontario to describe the range of youth and mental health activities, initiatives, service, and programming that was occurring across the province in the public health units. And one of the future opportunities that was identified through the Connecting the Dots report was that public health staff from across Ontario wanted access to knowledge exchange among public health units and community partners. So that report, Connecting the Dots, can be found online if anyone's interested. There was an additional report that was done by CAMH titled Pathways to Promoting Mental Health, and this looked at an adult population in public health units, and what people were identifying as needs was very similar to Connecting the Dots in that adult population. And so this sort of need was becoming more increasingly evident. In my personal practice, I received a ton of phone calls as being part of this report, as being part of Connecting the Dots. I started to receive phone calls and emails from public health unit staff from across the province, asking me to share our Toronto Public Health reports, describe the work that we do here, asking about specific programs and activities that our team works on, and sort of share those resources. So there was many, many phone calls. During this time, I also received an invitation from another health promoter in Halton Region, Melissa Graves, and she asked me to start attending an in-person meeting along with other health promoters from Southern Ontario. So I think we were Halton, Toronto, Peel, Hamilton, and Niagara. And we met for a couple months, or every couple months, to share updates on our work, our resources, and provide a bit of moral support to the challenges we faced in doing this work that wasn't really well defined and sometimes faced a little bit of pushback because it wasn't made so specific in the Ontario Public Health Standards. So also during this sort of early forming stages, I reconnected back with Ben Lakin from Ottawa Public Health, and he had been involved in the Connecting the Dots report around Ottawa's role in mental health work, and we sort of decided that we should get back in touch with our colleagues at the PSSP and EENet to see if we could look into developing a community of practice, since this was an identified need. Ben was also receiving a lot of calls about the work that Ottawa Public Health was doing, and I think between the small group and Ben and myself, we were just sort of referring anyone who was interested to each other, so it was taking up a lot of our time. And yeah, during this time, a very clear need was identified that in the absence of direction from the Ontario Public Health Standards, there was a need to connect public health staff, public health unit staff from across the province to exchange information and resources related to mental health promotion in public health. So at the end of 2016 and beginning of early 2017, Ben, myself, and a group of 5 other staff from public health units who had been meeting informally, linked back with EENet and began to explore the possibility of developing the community of practice using the EENet platform and the support of a knowledge broker. Our need was to develop a more formal mechanism to share information and connect with other public health units from across the province. So we're working with Joelle Bailey, who's our knowledge broker, and Tamar Meyer, who's the supervisor of knowledge exchange at PSSP, and they helped us develop our terms of reference. So in that terms of reference, we identified that the mental health promotion and public health community of practice will bring together public health practitioners from Ontario's 36 public health units working in the field of mental health promotion across the lifespan. The purpose of the community of practice is to connect, share, and explore the practice of mental health promotion in public health at a population level vis-a-vis the implementation of evidence-informed practices and practice-informed evidence. So we formed a steering committee for the community of practice, and it has membership from 7 public health units from across the province, so it's kind of expanded a little bit. EENet supported us in our decision to limit our community of practice to those working in public health units, meaning we have a community of practice rather than a community of interest, but there is a potential to open it up to those partners working outside of public health units in the future. And we began to have monthly meetings to discuss our strategy for opening the group up to all 36 public health units and populate our space on EENet. We also had an opportunity to have an in-person meeting in November 2017, and that helped us develop our model for disseminating the community of practice across all 36 public health units. So truly the timing was right because we knew that the Ontario Public Health Standards were being revised and launched at the end of 2017 or early 18. So a little bit about our activities and outcomes so far. As I mentioned, we had that one in-person meeting, and that was hosted at CAMH. Since formalizing our community of practice, and this is a great opportunity for the steering committee to meet each other in person or over a web connection, at least face-to-face that way, after many, many phone meetings. With the support of EENet, the Ministry of Health and Long-Term Care was able to connect with the community of practice for feedback on the new mental health promotion guidelines, which are going to be accompanying the new standards, which haven't quite been released yet. We were able to participate in providing 2 rounds of feedback via phone consultation with the Ministry of Health and Long-Term Care on these guidelines. We hosted our first webinar, so the launch of the community of practice to public health staff was on December 1st, 2017, and we had approximately 130 people attend that webinar, so we were very pleased with that level of participation. We currently have 29 of 36 public health units who have identified champions, so that's pretty awesome too. We're really looking forward to getting those last 7 on board, and I think we can do it. It's pretty exciting. And we have developed an interactive online space. So with the support of Joelle, she's helped us set up, populate, and categorize content on our site. And we've had, I think, at least 65 new users register to be part of the online space since the webinar. Our next steps are to develop a survey that's going to look at knowledge gaps and developing knowledge products that would be helpful for the implementation of the new standards and guidelines. Also, to promote the community of practice via conferences and events such as the Ontario Public Health Conference, and continue to support public health units as we all look to implement and integrate mental health promotion based on the guidelines, since there's new actions happening. So EENet has truly been instrumental in its support to this community of practice. Given that all of us who are part of the steering committee have additional activities in our roles and responsibilities outside of the work on this, it's been truly so helpful to have the support of EENet, specifically Tamar and Joelle. Having the online platform is a great tool to let the knowledge sharing continue to happen organically. So instead of having to have a small little side group happening, we can do it in a more public forum for our public health unit staff. And since so many public health units have been working independently on this mental health promotion work, we often were reinventing the wheel. Like, it was a waste of publicly funded resources, so this truly does help us address that wastefulness. The community of practice allows us to share, question, inquire, collaborate, and even though it's still in a relatively new stage, there seems to be a lot of appetite for sharing and connecting around mental health promotion in public health, especially in this time of health systems transformation in Ontario. EENet has helped us connect with other key players, such as the Ministry of Health and the Centre for Innovation in Campus Mental Health are a couple of examples. And it's given us the space and support for this, for an opportunity to further legitimize the role of mental health promotion in public health, meaning that we can feel confident that promoting mental health is a key part of public health practice in Ontario. And that is it for me.
That's great. Thank you so much, Jessica. And we'll pass it along to our last presenter of the day, Rod.
Yeah, hi. Good afternoon, good morning, good evening for those who are tuning in from across and outside of Ontario, across the country. My name is Rod Alta. I'm a Senior Integration Specialist. What is that? I'm a health system planner, basically. And the local health integration networks, of which there are 14 in the province, work very closely with the Ministry of Health and our service providers, try to manage that money and make really sound investments in service. going to be flipping through a couple of slides here back and forth. You see there a picture of the Ontario region and LHINs. Champlain is Ontario's easternmost LHIN, includes the beautiful city, I would say, of Ottawa, and that's pertinent now if you're traveling to Ottawa because we have the canal open. So come down to Ottawa and skate on the largest open rink. We share a large border with Quebec, over 400 kilometers. Our mandate with all LHINs is to ensure that health services are well organized, appropriately funded, or at least using the funds that we receive from the Ministry of Health, to meet the health needs of the regions, all 14 regions in Ontario. And in Champlain, that means about 1.3 million residents. We work with, in Champlain, about 120 health service providers. That covers about 240 health programs in hospitals, community support services, mental health and addiction services, community health centers, and long-term care homes. And as of this last May of 2017, the Champlain LHIN, as all LHINs, also deliver home and community care services. So previously, we weren't a service provider. We were health system planners and accountability folks for ministry funds. We went through integration with what was formerly called the Community Care Access Centers. And now, at least from our office, we're, I think, a group of around 50 to several hundred now. So it's a real change for us and how we deliver services because, as I said, we're service providers now. How do we use, or how do I come into contact maybe with EENet and the Rapid Review Service? I've been familiar with the Center for Addiction and Mental Health, and not just as a LHIN person, but previously as my knowledge broker, in my knowledge broker role with Canadian Center on Substance Abuse. I've also worked in the treatment world, so I was familiar with services in the community and in Toronto. But specifically around this particular service, the Rapid Review Service, it was back in 14-15, we saw the need for more withdrawal management services in Ottawa. The need was increasing there. Probably like most major centers, there's a need for this. The community saw a need for inpatient beds in Ottawa. It far exceeded what we can fund at the LHIN level anyway. We know that in Champlain, and it still is the case, there were no withdrawal management beds that existed outside of Ottawa, and yet our needs are great in our communities. We'd also seen a transition at one particular health service provider, that of Cornwall Community Hospital. They had transitioned, they had a small withdrawal management program, and they transitioned those beds to community withdrawal resources very successfully and found that they could offer more services to more people in their community. I think there's a timing issue here as well in 14-15. There was, at that time, the Champlain LHIN and all LHINs received Ministry of Health base funding for mental health and addiction services. For us, I think it was around $4.5 million at the time, which is roughly about 10% of what the investment is for the province. So we saw this as a real opportunity to invest in withdrawal management services that served the entire region of Champlain. And for us, the region is diverse. We have a large center like Ottawa, but we also have rural and remote centers across Champlain. It's a fairly large region. We also have 2 First Nations reserves in Ottawa and a very large Francophone population. The challenge, of course, is how you provide these kinds of services, withdrawal management, when beds are very expensive, hard to find. Could we duplicate or find similar results and achieve them in the community? So we had a couple of options with this. We could go through a longer ministry process and look at perhaps a capital build. So buildings are hard to find sometimes. So we could go with withdrawal management vetted services, but that includes a long process, a little bit uncertain, often several years if it's a new build with the Ministry of Health. Or we could look at taking what we had seen with Cornwall Community Hospital and see if we could, through a little bit more work and research, embed and fund some community withdrawal management services across the region, provide a little bit more equity of services. What was the biggest impact we could possibly get? What would be of the most value to us? So to answer the question, we need to go to the available evidence. The LHINs, as health service planners, we certainly wouldn't have the resources to do this kind of research or rapid review. Our health service providers don't have those resources or expertise typically either. You may find some of that in a community health center or a hospital, especially an academic center, but typically service providers are funded to provide direct service. And so this is a different area of expertise. We knew that, I knew that, EENet had the knowledge of addictions evidence, and we wanted to pilot a new process for conducting evidence reviews. At that time, and I still am, was on the EENet steering committee. And so we were looking for opportunities to kind of try this on. So there was, as I said earlier, there were a lot of timing issues here. Funds arrived, had some success in one area, wanted to scale it up a little bit more. So we thought it was an excellent way to obtain this evidence in a much easier and, for us, often important and more rapid way as well. So what did that process look like for us in working with EENet? I mean, in a word, positive, very positive. The process of developing a rapid review to answer a question involved pretty close collaboration with an EENet knowledge broker in a very short amount of time. I often say, we had contextual conversations with the knowledge broker and the EENet team, and contextual, refers to, what does it look like in Champlain? Because the services for withdrawal management may look different in one area versus another. I mentioned the Francophone population. We have Indigenous populations in our region as well, also a very large Inuit population. So those conversations were really crucial to find out, what do we want to find out? What were our goals? We had a couple of meetings to define the question, the research question a little bit more. I think the knowledge broker, I recall the knowledge broker going out, bringing back some preliminary findings. We hashed out a bit more and maybe define or refine the question a little bit more, and really look at the target audience that we were studying there. So lots of conversations, but also what we're aware from the very beginning, how do we once we understand all of this, how do we disseminate these findings to a group so we understand it and deliver that? Because if you're like most of us, your email is full and there's way too much to read in too little time. So rapid, short, brief, to the point was really important to us. We found that the knowledge broker with EENet really understood our needs. By the end of this, we've taken our feedback. We talked to them about we want to use this in other settings as well. We don't want to just have this, applicable to Champlain. We want to share this with all LHINs across the province. And indeed, that's what we did. Really good outcome, I would say. It met the needs that we had at that time. Developed with key messages, or report in short, the one-pager that we all wrote, condensed Cole's notes as he wrote. It identified the methodology in rapid review. It showed there was a synthesis of the available evidence on the topic, and for those who wanted to take a deeper dive, provided some good references as well. Clear language, well-spoken, helped us make the decision we wanted to make. So we used that evidence in conjunction with the health service providers, helped inform our investment decisions for not only new services in parts of Champlain, but to enhance the existing services. So in Ottawa, that meant how do we add on a community withdrawal management team, and how is that going to supplement the system of care that flows within withdrawal management services generally, and then into treatment settings, for instance. So it accelerated our decision making. Really important for the LHINs to have this information fairly quickly. Typically, we receive Ministry of Health funding quite late in the fiscal year, often in the third, usually in the fourth quarter, and we have to make decisions on investments in a very short amount of time. We obviously want to get the best value for our money as well, to get that money out to our service providers so we can serve people in the community as quickly as possible and as best we possibly can. In the case of withdrawal management services, you can imagine that these are client populations with very critical and life-threatening needs. So the outcome, it allowed us to move on with investment decisions, implement services that were very needed in our communities. I think I'll stop there.
That's great. Thank you, Rod, for that great overview and another comprehensive look at what EENet has offered for you in your situation. So thank you very much to all of our presenters, Nandini, Betty Lou, Jessica, and Rod. That was a really great presentation and overview of the resources. So I'll just move ahead here. So I'll let everyone know that we're going to open up our Q&A. So feel free to post any questions that you have in the chat section or the Q&A section, and then I can read those aloud to our presenters. So you might have a question for just one presenter or just about EENet itself. So I'll monitor those and then read those aloud to our presenters. In the meantime, while our attendees are thinking of their questions for our presenters, we'll just move along to, we have a few more polling questions today that we'll post. So we're wondering who of our attendees could find EENet to be useful in practice. So it might be very useful, somewhat not for you, or you're not sure yet. So again, we'll just remind you to respond in WebEx, and then just remember to hit submit, the submit button at the end. And we'll leave that question open for just a little bit more. So really great to see the few people who are saying that they found it very useful or somewhat useful. So I think 11 people so far who are finding it very useful. I'd be really interested to hear how those folks think they might use EENet in their practice, or what sort of background they're coming from, because I think it was made very evident that these resources are applicable to many different even fields and types of professionals. And moving along, in our slides, your feedback is really important to us, and we posted, we'll post a link in our chat section. So please take a few minutes at the end of the presentation to complete the survey and provide any feedback that you might have on the tool or on our whole Spotlight webinar series. We welcome any feedback that you have, and we really use this information to help inform the webinar series itself and select methods or tools to feature in future sessions. So again, that short survey will be posted in the chat section. Great. And then we'll have one last polling question. We're wondering what your next steps are. So if anyone's been thinking about how they can use EENet in their practice, that would be really great. So you may decide that you can access the method or tool, read the summary on NCCMT, consider using the method or tool in practice, or tell a colleague about the method or tool. So you can select all that apply here. And thanks to Rawan, so we have one question so far. Someone's asking, are there any plans to eventually expand EENet beyond Ontario? So maybe Nandini, you can step in here.
Yeah, sure. That's a great question, and I would say that we have done a bit of work to support a small handful of initiatives at a national level. So, for example, when we were supporting some of the initiatives across Canada that were funded through Health Canada, focused on improving substance use treatment systems, we did do some support with some of the national projects and some of the projects that were taking place in other provinces and territories across the country. So every once in a while, we do sort of dip our toe more into the national context. We don't have currently any concrete plans to expand at a national level, but we're definitely sort of interested and open to exploring partnerships at a national level that would also really connect and help us with our work provincially as well. So I think that's what my response would be to the question asked. Thanks, Olivia.
I wonder if I could just Rod here. Can I add to that?
Absolutely, that would be great.
Yeah, I mean, to the person who asked the question, You know, what I find is, I don't even have enough time to go through it all, but the EENet site is terrific just in terms of existing resources. So I think in that way, of course, anybody can access the site, spend some time there, not just looking at the rapid reviews, but any of the resources that EENet offers. I've sent it out to our house service providers, and they've really appreciated just the quick access. Like many of us have sort of those go-to sites, and EENet is certainly one for me.
That's really great. Thanks, Rod. So just to add on to that, Nandini, do you find you have users who are from beyond Ontario who are using the resources and find them applicable?
Yes. I mean, so for example, we do have users on EENet Connect, our online community, who are definitely from different parts of Canada. And I think in terms of people who access our website as well, I think there is a sense that there are people accessing resources from outside of Ontario. So I would definitely say that does happen. And the other resource that we also share once every 2 weeks is an EENet newsletter. And I know through the newsletter there are people from across the country who are accessing that specific resource.
That's great. Thanks very much. I know that's one thing that really stood out to me, you know, in my field of work, and what individuals that we come into contact with find is that for public health professionals and even beyond health professionals, how do we get people to connect with each other? So EENet Connect was one great resource that I found that really stood out that I would find very useful. So I definitely appreciate that part. And we just invite people, if there's any other questions, in the Q&A and chat section. In the meantime, we just have a few more slides to go through. We just remind people to share your stories. So if you're using EIDM in your practice, we'd love to hear about it. Or if you're using EENet in your practice, I'm sure we'd love to share that with Nandini as well. So our email will be posted there in the chat section, and again, it's on the slide. And if you need support for EIDM, contact us for help. We're happy to respond to any of your requests. We typically respond within 24 business hours. We're happy to have you contact us for that. And just a little bit more about our webinar series from the NCCMT. So we have our Spotlight webinar series, and we have a link for that we'll share in the chat section. And we also have topic-specific methods and tools, an online journal club where we have a select number of individuals who will join a journal club, and we'll go through the critical appraisal and review of a systematic review together as a group. And we'll have everyone who attends those series be able to speak on the line. So it's a really great session. And our peer-to-peer webinars. So again, you can find a little bit more information about all of those online. And that's great. So not too many more questions.
Lydia, I was just wondering, this is Nandini here. Would it be possible for me just to make one additional comment?
Absolutely, for sure.
Yeah. So one thing we can share with everyone in the chat box is a link to a report that we just shared yesterday and we launched publicly yesterday. So it's essentially the results of a province-wide process that we undertook with more than 500 stakeholders of the mental health and addiction system, really to understand their priority evidence needs as it relates to improving how the mental health and addiction system functions. So we had a series of dialogues, did an online survey, and so this report that we'll share the link with you, it really identifies the top 10 evidence themes and needs that people identified. So I think that might be a useful resource for others to take a look at. And I also want to say thank you to Betty, Lou, Rod, and Jessica for agreeing to be a part of this webinar. We really enjoy working with you. Thank you.
Thank you very much, Nandini. That was really helpful. And we're happy that you're able to share those resources in the chat section. and to the rest of our attendees today. I know we've had one person already comment, thanks, it was a very interesting session, so that's great to hear. So I'll just leave it, just want to give a big thanks again to Nandini and Betty Lou and Jessica and Rod. It really created such a comprehensive and in-depth discussion today to hear about the use of EENet from so many different perspectives. So I'll leave it to our user story presenters if you have any other final comments that you would want to leave today. I think that might be it. We just have Rod saying thanks for joining us and use EENet, so that's really great. And thanks to all of our participants. So a big thank you from the NCCMT. There's a large staff on our end who helped to coordinate this series, and Rowan, who's been helping to support this session from the back end. So we thank her for her support throughout this session. So thanks very much, and have a good afternoon, everyone.